She had no warning signs, no headaches, no chest pain, no sudden numbness or slurring of words in the days leading up to it. She was 71 years old, active, sharp, the kind of woman who walked her dog every morning and did the crossword in pen. On a Tuesday afternoon in March, she stood up from her living room chair, took 3 steps toward the kitchen, and collapsed. By the time her husband reached her, the left side of her face had gone slack. The stroke had already begun. In the hospital, her doctors ran every test available. Her cholesterol was normal, her blood pressure was controlled, her heart rhythm was steady. Everything on paper looked fine. So what caused it? When they reviewed her daily habits in detail, one pattern emerged that nobody had previously considered dangerous. And it is the same pattern that millions of people over 60 repeat every single day without giving it a second thought. I am Dr. Arya, and on this channel, Senior Health, I talk about the things that quietly shape your health after 60, the patterns hiding in plain sight that nobody warns you about until something goes wrong. Today, I need to tell you about a daily habit so ordinary, so embedded in the routines of older adults, that calling it dangerous sounds almost ridiculous. But the medical evidence connecting this habit to stroke is not ridiculous at all. It is alarming. And by the time you finish this video, you will understand exactly why this one overlooked behavior may be the single most modifiable stroke risk factor in your daily life. The habit is this: you are not drinking nearly enough water. And I do not mean you are mildly, inconveniently dehydrated. I mean that your body right now today may be operating in a state of chronic low-grade dehydration that is measurably thickening your blood, stressing your cardiovascular system, and creating the exact internal conditions under which strokes occur. And the worst part is that your body has stopped reliably telling you about it. Let me explain why this is fundamentally different after 60 than it is at any younger age, because this distinction is everything. When you were 30 or 40, your thirst mechanism was precise. Your body monitored fluid levels constantly, and the moment hydration dropped below the optimal threshold, you felt thirsty. Unmistakably, urgently. You drank water, the signal stopped, balance was restored. The system worked almost perfectly for decades. After 60, that system begins to fail, not dramatically, not in a way that announces itself. It fails quietly, gradually, in a way that most people never consciously notice. Research published in the journal Physiology and Behavior demonstrated that adults over 65 experience a significant reduction in thirst perception. Your body still needs the same amount of fluid. In many cases, it needs more, because kidney function naturally declines with age, and your kidneys require adequate hydration to filter blood efficiently. But the signal that once drove you to pick up a glass of water has become muted, unreliable, sometimes absent entirely. So you go about your day. You have your morning coffee, maybe a small glass of juice. You eat lunch, perhaps with a few sips of something, and by 3 in the afternoon you have consumed less than half the fluid your body requires, and you feel completely fine. No thirst, no discomfort, no warning. Meanwhile, inside your blood vessels, something is changing with every passing hour. Here is what happens to your blood when you are chronically underhydrated, and I need you to picture this clearly because understanding it could save your life. Your blood is not simply a red liquid. It is a living, flowing tissue with a specific viscosity, a specific thickness that allows it to move through your vessels efficiently. When hydration drops, your blood plasma volume decreases. The ratio of cells to fluid shifts. Your blood becomes thicker, more viscous, stickier. In a younger person with wide, flexible arteries and a powerful heart, slightly thicker blood is an inconvenience the body manages without difficulty. But in a body over 65, where arteries have stiffened, where vessel walls may already have some degree of plaque buildup, where the heart is pumping with slightly less force than it did 20 years ago, thicker blood is not a minor inconvenience. It is a genuine threat. Thicker blood moves more slowly through narrowed vessels. It is more prone to forming clots, and a clot that forms in a vessel leading to the brain is the textbook definition of an ischemic stroke, the most common type of stroke in older adults, accounting for roughly 87% of all stroke events. You did not eat anything wrong. You did not skip your medication. You did not have dangerously high blood pressure. You simply did not drink enough water on enough days in a row, and your blood slowly became thick enough for a clot to form in exactly the wrong place at exactly the wrong time. This is not theoretical. A study published in the journal Stroke found that patients who were clinically dehydrated at the time of a stroke had significantly worse outcomes than those who were adequately hydrated. Their strokes were more severe. Their recovery was slower. Their mortality risk was measurably higher. Dehydration did not just contribute to the event. It determined how devastating that event would be. And here's the part that makes this even more insidious for people over 60. The most dangerous period is not the afternoon. It is not during exercise. It is first thing in the morning. During sleep, you lose fluid steadily through breathing and perspiration for 6 to 8 hours without any intake whatsoever. By the time you wake up, your body is at its most dehydrated point of the entire day. Your blood is at its thickest. Your cardiovascular system is at its most vulnerable. This is exactly why research has consistently shown that strokes and heart attacks occur most frequently in the early morning hours. Not because mornings are inherently dangerous, but because your body has gone the longest without water and your blood has reached its peak viscosity at precisely the moment you are getting up, changing position, asking your cardiovascular system to perform when it is least prepared. That woman I mentioned at the beginning, the one who collapsed on a Tuesday afternoon, her doctors eventually traced the contributing factors back to a pattern so simple it was almost invisible. She drank coffee in the morning, which is a mild diuretic, meaning it actually promotes fluid loss rather than hydration. She sipped a small glass of water with lunch, and that was largely it until dinner. Day after day, week after week, month after month, she never felt thirsty. She never felt dehydrated. Her body had stopped sending that signal years ago, but her blood had been thickening incrementally with every underhydrated day until one afternoon in her own living room, the consequences arrived all at once. I want you to think about your own day honestly right now. From the moment you woke up this morning until this very moment, how much plain water have you actually consumed? Not coffee, not tea, not juice. Water. If you have to think hard to come up with the answer, or if the answer is less than 4 full glasses by this point in the day, you may be living in exactly the same pattern, and your blood may be thicker right now than you realize. Let me tell you what to look for, because dehydration in older adults rarely presents the way people expect. You may not feel thirsty at all. Instead, you might notice that your urine is consistently dark yellow rather than pale straw-colored. You might experience headaches that seem to come from nowhere in the late afternoon. You might feel unusually fatigued by midday despite sleeping well. You might notice that your thinking feels slower, cloudier, less sharp than it used to be. You might have experienced dizziness when standing that you attributed to blood pressure or simply getting older. Every single one of these can be a sign of chronic dehydration, and every single one of them is your body telling you something that your thirst mechanism no longer bothers to mention. Here's what I want you to do, starting tomorrow morning. Before your coffee, before your medication, before anything else, drink a full glass of room temperature water. Not cold, because cold water can be a mild shock to the system first thing in the morning. Room temperature. A full glass. This single act begins to reverse the overnight dehydration that leaves your blood at its thickest and your stroke risk at its highest. Make it the first thing you do when your feet hit the floor. Before the pills, before the coffee. Water first. Then carry a water bottle with you throughout the day. Not because you will feel thirsty. You probably will not. That is exactly the problem. Drink on a schedule, not on instinct, because your instinct is no longer calibrated correctly. A reasonable target for most adults over 65 is 6 to 8 glasses of water spread across the entire day. Not all at once. Not crammed into the evening to make up for a dry afternoon. Spread evenly. 1 glass upon waking, 1 mid-morning, 1 before lunch, 1 mid-afternoon. 1 before dinner. 1 in the evening, though not too close to bedtime if nighttime urination is already a concern for you. If plain water is difficult for you, and I hear this from patients constantly, add a slice of lemon or cucumber. The flavor makes a genuine difference in compliance, and there is no downside whatsoever. What matters is volume and consistency. Your blood does not care whether the water tastes interesting. It cares that there is enough fluid to maintain the viscosity that keeps it flowing safely through your vessels and past the narrowed points where clots are most likely to form. There is one more thing I want you to understand because it connects everything together. Dehydration does not only thicken your blood, it also raises blood pressure. When fluid volume drops, your blood vessels constrict to maintain adequate pressure with less available fluid. This means your heart works harder, your vessels experience more stress. And if you are already taking blood pressure medication, chronic dehydration can make that medication less effective, leading your doctor to increase the dose, which introduces new side effects which create new problems. All because the underlying issue was never the medication. It was the water you were not drinking. I have seen patients whose blood pressure stabilized, whose medication doses were reduced, whose chronic afternoon headaches disappeared, whose mental clarity noticeably improved, all from nothing more than a structured increase in daily water intake. No new prescriptions, no expensive interventions. No dramatic lifestyle overhaul, just water, consumed consistently in adequate amounts at the right times of day. It sounds too simple to be meaningful. It is not. It is one of the most impactful single changes a person over 60 can make for their cardiovascular health, and it costs absolutely nothing. This week, I want you to try something specific. For 7 consecutive days, drink a full glass of water immediately upon waking and track your total intake throughout the day. At the end of the week, notice how you feel compared to the week before. Pay attention to your energy, your clarity, the color of your urine, the steadiness you feel when you stand. You may be genuinely surprised by what changes when you finally give your body the one thing it has been quietly asking for and can no longer ask loudly enough for you to hear. If this changed how you think about something as simple as a glass of water, send this video to someone over 60 who you know does not drink enough during the day. That share could genuinely matter more than you realize. Subscribe to this channel because next week we are going to talk about the 5 warning signs your body gives you in the 48 hours before a stroke. Signs that most people dismiss as stress or fatigue until it is too late to act on them. Everything I have shared today is based on current medical research and my clinical experience, but it is general health education, not personal medical advice. Your health history, your medications, and your specific conditions all matter. If you have kidney disease, heart failure, or are on fluid-restricted protocols, your hydration needs may be different, and you should discuss any changes with your physician first. Use what you have learned here as a starting point for a better conversation with your doctor. That partnership is always where the strongest health decisions are made. Take care of yourselves. I will see you next week.